Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest here is my friend, Troy Bannister, the founder of Particle Health. Troy, always good to see you.
Always good. Every time.
Yep. We have talked many times about how Particle Health is on a mission to kill the fax machine.
Yes.
Bring patient data to people in an actionable way. So tell me where we're at with Particle Health in 2023.
We are about a year post-Series B.
Nice.
So we've grown the team quite a bit.
Raised how much in total?
About mid-40s, so
40s?
45 million about.
Okay.
I should know that number. So grown the team quite a bit. We're really kind of in that scale phase, right? The product works. We've proven it generates revenue. Our unit economics are good. Our margins are healthy. How do we get that to more people faster and better? So we're looking at larger deals now, larger customers, bigger implementations. And we're getting really good now, finally, at understanding, why a customer would want additional clinical data, how they would use it, and then I think most importantly, how that improves patient outcomes and saves them money.
When you started, it was just a glint in your eye. It was a dream.
Yes.
Now you're in this scale-up phase,
Yeah.
and I'm guessing the challenges are completely different. So
Yes.
how are the challenges different than they were in the beginning and different than what you expected?
I am a 0 to 1 person, and I think what I mean by that is you have this one big hairy problem. How do I get everybody's, or a person's full longitudinal medical record aggregated in seconds? And like you mentioned, that's a dream in the beginning. And I remember when I was starting the company, many people were like, nope, it's impossible. You can't do it. It's never going to happen. Once you solve that problem, now the next problem is how do you replicate? How do you scale, right?
Yeah.
So it's a completely different problem.
Yeah.
I'm not thinking about how to aggregate medical records anymore. I'm thinking about how to scale a sales team, how to build better pricing models, how to improve our margins. It's P&Ls, it's CRMs, it's all the acronyms.
Yeah.
Before it was just hack, ask questions, ask the whys, get the right people on the phone, knock down doors and walls to get places and get things done. Totally different now.
So you made the bold move of hiring a new CEO. You saw this scale-up challenge. You had enough self-awareness to know, here's where I excel, here's what the company needs. Tell me about that process.
It's an emotional one for sure.
Yeah.
But when you kind of push that down a little bit and you think logically, we have such a good thing going on. The company's doing well. I was able to solve this really tricky, technical problem. How do we actually get this thing pervasive? How do we solve this across the healthcare industry? And at that point, you go, okay, am I the right person for that? And yeah, I probably could have done a decent job at it. I think I could have. I know I could have. But I also knew there was other people out there that have done it before and were absolute rock stars at it. So you go find those people and you get them to come on your team.
Yeah.
And you have to take a big step back and kind of swallow that pride pill a little bit. But all you really want at the end of the day is for this solution to solve the problem. And so you get somebody in there that can do that.
That self-awareness shows a lot of leadership, and you have grown that over your time as a CEO.
Yeah.
And prior to that, you were actually with Startup Health, and I remember you were an EMT when you started. You've been on a long journey, okay?
Yeah.
So, I don't know, what are some of those milestone lessons that you've learned along the way just about leadership and about innovation?
I think there's a couple really important broad stroke things. People is by far the most important component of building a business.
Did you always know that, or did you learn it along the way?
I didn't know how important it was.
Got it.
I thought maybe it's 70, 80% weight. Yeah. I think it's 95% of the weight.
Wow. Okay.
The people are what makes a business great or okay or bad. That's it.
Yeah.
There's a small margin.
So I bet it went from head knowledge to heart knowledge, you might say. It becomes real.
I think if you're an early stage investor, I think you know this really well, right? You're not investing in technology, you're investing in the early stage team because products change, people pivot, the market changes. Yeah. The one thing that doesn't change is the group of people, right? And if you get the right group of people, they'll move faster, they'll iterate faster, they'll solve the problem faster, they'll execute faster and better, right? Yeah. that's the core common denominator, is the same people working at the same company every day. And I think most first-time founders probably know that, but don't rigorously spend the time and energy to ensure that they're doing it.
They aren't as obsessive about it as maybe they need to be.
They may not use an executive recruiter, right, for a really pivotal role because they think they can go find the right person.
You recommend that?
100%. Like, you spend the money to go. The reason is there's a great market of talent out there, right? But the best people are the ones that are very happy in their cushy, awesome jobs. A recruiter can get them to come take a call with you. You can't really get them to come take a call with you very easily, right?
Interesting.
So it's that type of thing, right? It's these recruiters are expensive. You're spending $100K retainer just for them to go find people for you, right?
Wow.
And you're like, you do that 3-4 times in a row and you build out an executive team. It's worth it.
Yeah.
In order to be the best company in your category, you need the best people running it. There is nothing between that.
So you've learned or come to a greater appreciation of the value of people. Now, what about managing people? Because you went from being you and your co-founder to now how many people on the team?
So I think this is the 70 plus.
Yeah, that's a lot.
I think what's interesting about this question, the early days is a very different management style than the scale days. Early days it's a little loosey-goosey, right? What do we have to do to solve this problem? All means necessary, right? Show up at the conference even though you're not invited and pop into the meeting and get that card. Whatever it is, right? You hack at it. After that, solving the problem, that 0 to 1 point, it's all about rigorous discipline and repeatable standardized processes. It's documentation. It's using tools and making sure everybody's using the tool the right way. And that's, to me, it's a little bit more boring. But that is what makes a business successful.
What makes it scale.
Yep. It's the rigorous discipline, the operational discipline.
Do you find yourself, so now you're in this chief strategy officer role, right? In your new role and kind of new vantage point, do you find yourself finding new areas where you can go 0 to 1?
Well, that's kind of the job, right? I'm doing a lot more thinking than doing, and I'm doing a lot more writing than than building. So it's a very different role, right? Before it was, I'm going to close this deal this week, and now it's like, what does healthcare data interoperability look like in 3 years? And how is info blocking play a part? And what is TEFCA going to do? And how does promoting interoperability change? And I have to meet with the ONC to understand what's around the corner, right? It's like, that's
cool.
It is cool. It definitely is cool. And it's fun to think about that and write it. And you know this, you're a writer. As you write, you kind of develop additional insight, right? If you get it on paper and you put it into a sentence.
I have to write to know what I think.
Exactly. You have to write to know what you think. And after writing and then deleting and then writing it again, you start to develop a more crisp and concise and I think thoughtful point of view on these types of things. So the writing process in and of itself is super enlightening. And so I've been doing a lot of that.
What updates should we be looking forward to from Particle in the next 6 to 12 months?
So there's some massive, every time we talk there, I'm like, there's another massive regulation change. And it always is.
Really?
Yeah, so TEFCA, the Trusted Exchange Framework and Common Agreement, basically what it's doing is saying, healthcare data is sharing at this level today. Everybody now has to share at this level. More data, more use cases, and so they're rising the common denominator. All hospitals, all labs, everybody has to share data with greater access and fluidity. That starts by the end of the year. Wow! So there's this new regulation is
ball
pushing
just
through.
Keeps rolling.
So this is probably the most aggressive. Not probably. This is the most aggressive interoperability regulation ever to come out in the United States by far. It's going to create a common data sharing paradigm.
Does it have teeth?
Not yet.
Okay.
So this is the great debate. Should it be a carrot? Should it be a stick? The ONC has not decided yet.
Okay.
They're debating, without getting too much into the details, including some provisions that say, if you join TEFCA, you don't have to worry about this stuff that you had to do before. So some of these meaningful use, which is now promoting interoperability requirements, just forget about them. If you do TEFCA, you're good. So they are kind of making it easy for EHRs and hospitals to opt into TEFCA and not have to do this other stuff anymore.
Interesting.
Yeah.
Cool. Troy, that's our time. I appreciate you coming by. I always love getting an update on what Particle Health is doing and to get a glimpse into your sort of macro journey as a health innovator and a leader. So appreciate it.
Appreciate it.
All right. Keep up the good work.
Thanks, man.
Stay writing.